Anokwasem say afe na makoma atomiyem. Efri say efri mra me ba abrochime mu ha. Mahwehwe Ghana enuane ne eho akade nyinara. Nanso menye bi. Kosi say obi kire me African International Market na anokwasem say me bora ho no makoma tomiyem. Efri say dia me pe nyina bi wo ho. Me kire say African International Market a home of quality African and Caribbean foods, foodstuffs, fresh and dried fish, meat, beverages, and empo cosmetics. Ope Ghana eduane papa edi na ope ahoniama ato na wodi akofia kwaye webiane a enko bebia Bora African International Market efri se eho na wo benya ne a wo hwehwe nyina no wato aha me kire se dia ope bia a wo benya bi ato Ghana no ebi ewo African International Market a ewo abrochima mu ha ha ho enkra obi emane ntom famfo plane enfam brew enkra obi emane ntete ne ho na onha ne ho mfa obre bebre mu Bora African International Market na obenya dia wo pe nyina bi wo ho wo pe more na wo dia kan obe nko bi edi ana wo pe banche e dia wo fufuo bi ediam wakoma to wo yem body ampesi adokon enu nti wetia e pe body ato na wunya bayre anase kontomre anase emponya ado a mesrew entete biom Bora African International Market na obenya ne nyina bi wo ho sa wo hwehwe ye chi akwan we new place na Your 289 Muddy Branch Road, Gettysburg, Maryland 20878, close to Planet Fitness and Lot. Obetumia frey wo ahomatrofo iso 240-477-4831. Mrs. Ubium 240-477-4831. Anase 301-2375-497. Anase obetumia send me an email ewo africanentmarket@gmail.com. Anase mpo your website www.africaninternationalmarket.com. African International Market, home of quality foods.
My heart's awake to give you praise. Oh, may the meditations of my heart be acceptable to you. Yahweh, why are you
So honey amani ebru misua na meni dasu nyina sampwa meni dasu mi wo ye ba kope ehon so na menya ara chichire nyamesemu amenya ni ho nkuranshe nsemu amenya ni ho enyupa menya ni ho obi baby sami say asunde radio sami dawani minja hoti arado sami kasa sunde radio eya jimi so sa sunde kwa etiefo munua papa sini miti asunde radio enti usu ti yare yo
Yamamba, Swasi Ajuma, Sia Brosansa, Yadi Jumuda and Ferrotimu. When you won't go to a baba.
All right, I'm out this year. My money na ajo at the Basum Radio. So, what is a new way? A born, I just say, Menason. Say, yes, I'm so bad with fear. Mountain, so now the media. Ya tuni di wa pombo ti say Eddie Ebra was somebody your life over YouTube until obetimi ahwe na wati the air costume so yebese so say mo mwa na mo share my nko achiri ewo radio no so na afei mo sanso share my nko achiri ewo YouTube so ye pese ye have gospel ya ye dey abetu dwai and I say have gospel ya ye dey ebe ye ko achiri na agi amanfo bebre ekra nkwa bebre ehu hia they say nti ye say ma mo share for my last week yɛntimi ama mframam na ɛso so no mo amutie no mutie sɛ yɛbɔ repeated version anaasɛ deɛ yɛyɛ dada ne bi sɛdeɛ ɛbɛyɛ a ɛwɔ hɔ a ne akaka yɛ ho na nkɔmmɔ a yɛdie no yɛnyinaa yɛasa so akɔ obɛno bɛsɛ revisit akɔ revisit no ɔkɔtie deɛ yɛkaeɛ no ɛna atimi aboa ɛnɛ nso so yɛasa baabia mu deɛ na nkɔmmɔ a ɛmu ohwam nkɔmmɔ a ɛmu ɔdɛ ne Nyankopɔn ne nam ɛyɛ Green Health Pharmacy for ɛde ɛbrɛ yɛn Dr. Kwame Ennin ɔde nam ne so ɛde ɛbrɛ yɛn sɛdeɛ ɛbɛyɛ a ɛwie bere mu yɛbɛte nsɛm ati sɛ sɛ woyi nyame asɛm firi hɔ no ma deɛ ɛwɔ hɔ bia mu a wɔsɛ wotie ɛne sɛ wobɛtie ɛnɔma a bɛtumi ama wɔapɔmuden no ɛtumi agyinagyina so yɛwɔ deɛ ahohom ɛde ba na ɛwɔ deɛ nnuane a yɛdie no so ɛkɔfa no nyinaa ɛde ɛba ne sɛ nti sɛ wotie a na afei wɔhu anamo a wotuo ɛde afa ho na deɛ de nnuanedie ɛde ba no so no wɔtumi abɔ mmɔde ano atwe ho ɛfiri ho ɛsan sɛ dɔkta me ate aseɛ sɛ yadeɛ na yɛhu ne nei ɛnyɛ ne ya na yadeɛ na ɛba na mmom yadeɛ na ansa na ɛbɛba no na kyerɛ sɛ mfie bebree ɛna akeka abɔ so a ɛtumi ɛde aba bɛto nei nti ɛbɛsrɛ sɛ yɛn nyinaa ma yɛni na hɔ na nkɔmmɔ a yɛdie nso so yɛntumi mmɔmmɔde na yɛntie na yɛntu ho anamɔ menopause weight gain and how your age may be affecting your weight and I say sɛdeɛ menopause yadeɛ yi a ɛha nipa yi obɛsɛ umuduru nso so a ɛsɛ yɛ nso so no sɛn na esi ebetimi akɔ de akɔ atia no ɛnɛ yɛsan so abebiem dia na menkyɛ ho ma menkɔ ahoma no so na yɛnsa ka doctor ha na woni yɛn twetwe nkɔmɔ doc yɛmɔ akɔ aba
yo hene michia wo ni etiefo nyina embrace
etiefo nyina jo so last week dia fail
okra am say na holiday nti am say decided to be take off kakra nti na man ba na sa no
yɛda sɛ na so atimi aba
smedamase.
Okay, the doing the major mama na a few seminar or no dia brain no we are na ya to aso.
Yo, in a message here will be na mafasa to the cases to each year obibia uti me enyumre. Then you can last week him say into me amba. But one of the topics are a dama koma so na mi say that be maybe akoma so. Ene ade a metanya ho cases any questions pa akona ende Yankopon ama yakwen say young kan wasem in the into the focus no will be on we can say low testosterone and that's a low T for short. Na said WBA me no by small house cleaning exercise kakra. I say product be am say me kan wasem a product so a damakon so with respect to treatment through diabetics ye free be neuropathy and I said diabetic neuropathy no pretty much I am not on nerves say because of high sugar levels in the sun comfort I am almost I almost treaty I am now almost starting pain friends as far as conventional treatment this any pako no your time mom will be a friend gabapentin ya mom gabapentin ya mom will be a friend lyrica idea ye nipa no bebre no eba ya omuntumi na nti wona asihye omo ebene yititriti ni nyina ye science o nerves no say because of high sugar levels na sadly no and the treatment adding conventionally crowd you need treatment to be our but holistically you will treatment but treatment in any idea overnight because it takes a long time to heal the nerves that be a cry no say akwenya ko say say me bo bi a go through sadie na you make sure say idea ko fa sa how no by which most of the time a sugar no a controlled because the sugar in you control that we are quite because we per se a very controlled you name ko bebre why you dey sa treatment no there will be a friend of B max and as a benfotiamine there were a lot of B vitamins how do I dey sa treatment and like I said na overnight but there's one product we used to come wash you have neurotrophin PMG now idea a boa with help with the nerve function. That's a what building nerves, and that's a damaged nerves, Into the idea you use for the nerves. Now, as a result of via stroke and I say other issues be no when your brain problems be maybe when your concussion be and I say or sport be and I say baby and I say be a when your memory loss and I say be a friend and nerve degeneration or no diabetes per se na deba but never be anything to do with the brain anything to do with the nerves you know that neurotrophin PMG and we use to and my kind of be say PMG no ejina homa mostly no the corona you treat no organ kidney PMG na say extract of kidney and yes and bring the integrity and we know of the corner in question in this particular one neurotrophin PMG a boy with anything with the nerves anything with the brain anything with head injury we can put neurotrophin PMG at the mouth on any product and then if we say when you say we did trim a idea nipa be no use for the last couple of weeks you should be brave as you have say men can't want some that if we say when here and so you do or no about between as a product review. Now, it also be a body role for true green food and true blue tea. Obi a wuti efoforo we nipa wuti efoforo na se wonte true blue tea for modern try so we try true blue tea. The nipa bebre no question say then a true blue tea no etumi boa with pain. Ono ni ade ba ko a question ba ko metenya because nipa bebre obo ha or stiffness of the joint obo ho be sorry na na pone na poso nyina etitriti anasa yes stiff na true blue tea ne tumi de boa no nipa bebre bi say then etumi yes ade no Kwame brave, but the main mechanism of SADI is how it will reduce inflammation by way of insulin. Into only idea in terms of Nijuma, you free man sugar. And I'm saying to reduce insulin to your boy with sugar levels, of course, a boy with cholesterol levels, and a sense of digestive effect. You need to cool be brave. Nanka every day and be a once a day, no more be a mujaman, but with the help of true blue tea, no. Be to me cut 2, be to me cut 3 into our side and a so strong function on the kidneys and to be a kidney issue. Be a kidney issue the beauty about true blue tea is a potassium can say potassium sparing, meaning say potassium no be bria body but only potassium is be so the cano it making it intact. When you put be bria or more junso as a result of true blue tea or more potassium levels and also air command. And what it does is it does not take out potassium when you don't have enough. And that's the beauty about true blue tea. To make comfort more be all person or improving the metabolic health, become metabolic health and making anything to do with blood pressure, anything to do with the cholesterol, anything to do with weight, anything to do with inflammation. Winner and a shot of how we breathe at the brain, including cancer, cardiovascular events in the account. To make comfort true blue tea at the ma obibia. And of course, want to make true blue tea once some young true green foods once some true green food here. Kua starch and all former a body per be the fact that you bab one thing for a year or so, no, still day in and day out, no, the any power must maintain that. And the one gentleman be by all the way from Maryland or send by a doctor, then the banner so what you share now Ombra and Obabe told me for the very first time. And the beauty about it in the explanation in the man, na papa no on charge, and so for one of the products now, Ubisa, and then a carbohydrate, and say, and we say, and was very fascinated by the fact that Nima Bibre and they'll find out I now win him or so a diabetic. I gave up when there or Kayana a year ago, say, even though no, the Banner doctor no is established among the family, say, body a good. That's a matter of fact, body no idea or say, a man, anytime you be Dibiano, what's around the pardon, and sugar no was sorrow. Intimate for me, Jonah, or Jonah, me fire one of the phones. Check the amount of carbs I will body and I'm trained what it means when it says so Google not type of plantain because the medium size is about 57 grams of carbohydrate. It is a way of math now. Then they say it's about who this are And so you're talking about 11 teaspoons of sugar. And keep in mind, we are diabetic, yeah, no, and yet we're down for. I mean, but based on where you are metabolically, body may not be your friend. And then I may come for true green food. And then my obibia. When you're pomade, nipple be brain, so feel say true green food, only for diabetics, only for hypertensives, only for more high cholesterol. And the current said, so we'll pomade India, you can put true green food mouth because in any United starch, so we'll chrome her, that's all to come, now we'll corner about only exercise, would be seed oils, I have body will say me and the that's need any form of regimen in terms of exercise, any quality meat, quality fat now. I can almost guarantee you, sir, at some point, you may be diagnosed with one of the metabolic disorders. So, what you mean? That's high cholesterol or high blood pressure, and that's diabetes, and that's so you're pre-diabetic, a science or serious medical condition that's so addressed because I never think it away, about how be brave, bro. Nipani be brave, who be so almost say, now what, yeah, mini blood pressure, pename. Blood pressure is a big deal. It needs to be addressed, and you can address that by way of diet. And anything that may count for true blue tea, any true green food, and the more be and I will mind so. It's only in house cleaning exercise, kakra, yedi betray. And the questions, I mean, yeah, and there's a lot of testimonies. They can say, Doc, I want you to talk about hair loss, Abi, Arizona. You say hair loss is more than a year ago into some permanent be a bit my repeat and answer a bit my university in a different angle. On which your man said, Doc, what is the essence of true blue tea? Said the kind true blue tea, a idea it has the ability to reduce your insulin levels. Would be our high levels of insulin? Put me how be in the topic here, be doing come who say insulin idea a gini per pa and so we team fufra ye bo insulin dia and gina say obi a or diabetic and say woman be a diabetic and say papa be and say one nabi yes can obi bia or what certain symptoms be and say what certain signs as a matter of fact we team na so high blood pressure I just say we insulin resistant. So, weight issue, I just say, you're insulin resistant. So, high cholesterol, I just say, you're insulin resistant. Would be a new kuma a sign, so insulin resistant. And the insulin resistance, young comma diabetes, on a name. A friend say, yeah, well, when it comes to insulin resistance, names are the Ubona, I near Bono. You just was a doc, I'm Linda. I was at your office for the first time. I heard them call you different names. I've also added another name, which is Dr. Miu Temanka. The issue is my older sister lost her eyesight at 56. I also started having issues and I came to see you. Even though what you gave me is something I pretty much have to take for the rest of life, I'm grateful. I'm better than ever before. And that you have restored my eyes and currently not taking any drops or medication for my eye. I can't thank you enough. Linda S. Laura Maryland. Linda Yankopon Shell. So, Doc, I know you are very busy. I came to your office and underestimated your practice. Everything you gave me is working and has changed my course of treatment. Currently in Ghana for good, but because of this transformation, I have decided to let you take care of my health. I'm 77 now and feel pretty good. Also, Kofi KBGH. Just with Doc. Some Saturdays are crazy at your office. We thank God for your life, Benjamin, Alexander, Virginia. And just was a Doc. I met you at the funeral and I was dazzled by your delivery. I heard things my doctor of 21 years having told me. It changed my life. God bless you. So, Doc, you are too busy, but you are worth the wait. Stephen, Stafford, Virginia. On any Yaman, for the betrayal. On any Yaman, for the betrayal, making kind. And I'm saying, I'm ready. Did you Madiana Bashasona, Eddie Accord, Yenimo?
All right, okay, that's see. I was seeing our friend was joining a higher from your radio. Said the OT, I was seeing more questions and more concerns. More the bread dog Naja. Will be more Eddie B. Amaya, so after be out to your coat game. A brand be an media making a basso now for Saturday, Anopa. Now you repeat media on about 10 a.m. Sanse, independent P. Also, my yard agency, meet Europe for no. I'm a fair muda and inti now, could say management say. Yeah, san repeat biem said be abusuafo mo so mo betimi asa betie. Afei nso so yesan so esadokoto SoundCloud asumje radio on SoundCloud or esadokoto anu so no obetima go back na akwakotie. Some de emre na so say ye de topic no ye di ho nkomo. De ya ne say the topic ne ba na afei mabusa doc questions na or de anu ye e de amayen. Doc and there was ye di nkomo e de akọ low testosterone ho. Na me wogidi mapa se testosterone ya dia wabo ho wabo aka ho asem na ya nsada ndo suko na mibisa se ye ka testosterone na e dia ade
yo he me sanda o sibio me sanfa with the cases so the child be able to for the first time I'm say the okay no you did testosterone ho komo pen ye ka testosterone na e mema hormone ono na e ma mema e ma ye ho ye fe ono na e ma ye nya abobise ono na e ma ye muscles ono na ye nyama bebrema mema e ma so be but the man in the kakre be tie ka testosterone na se tia ye ka e mema hormone ono na e ma bibia se wo low tia ono na e ma o mema ye no en sipe ye nti ka testosterone na e ono na gina ho for mema hormone so ye bema na se testosterone wo form a unya symptoms bebre a enye ni padua
yen hwe na topic de bia mebusaw na wo de anu yi ama me de enti na akohia se wo se di testosterone ho komo yi
yo onye me sa da wasibiom testosterone ya ade a se yi a metabolic nema ye ka ho asem titru insulin diabetes cholesterol hypertension which make us a idea me honi bebre na as matter of fact low T idea because a pandemic and because a pandemic here and it causes so many issues now in fact a member mono your type friend be say andropause and that's a male menopause do you be a would me and that's 30 years and that's 40 years and 50 years and 60 years this way I make some low T may be happening to you and in fact so low T now I'm feeling like crap so they put a custom on and the sad thing is that low T most often misdiagnosed meaning say you to me address it because I believe you know and then pain the pan baby it shows symptoms of low T and so and now also be a more age in the identity na you treat you more different and I say you should be before flow into your and then we say yes, because about 39% of the population was higher the way.
Doc, what can yes symptoms? Na yenhwe symptoms be na be there diam yen say low T and I say low testosterone.
So low testosterone you never be brebe there the mo so low testosterone. We be mostly no if you fan say 20 and 25 mono o say on active in terms of gym but you see we say well developed muscles and he said once a routine conforma once a video muscles and we general juma we do so shape no exercise I say more or less no a look to say 10% or bash body because skin no which really no man no more features because of estrogen but so body needs to say 10 or bana a sign say my friends and low T and there's a muscle loss near idea ade ba ko so won so bo say low sex drive idea edi akotene power and na service will catch them across so etumi emre we know so many symptoms but make na higher because you come you back on some break
yenhwe say ko ba say nisancheni a odi atutu dwai akoba say bema no so no nufu no ahya say bobo anu so betima ba say ne testosterone no e wo form ana
absolutely on na protocol say no can say man boobs no on na say egu ha ni na no nyema bebre na ekoso egu ha na all convert testosterone to estrogen ano na protocol say na some medical even aromatization obi wo ha by default no or yibi woni mu a ma ni nipadua no convert testosterone into aromatization so not too long ago me was Spanish ni bia me hwe na sa na ono by ne ye ma no treatment if no everyone saying testosterone patch or the bo na man testosterone but ye di money nyina no be share the labs no na the testosterone no e was stropa testosterone you mo hodo menu you were free testosterone and you were bound testosterone free no on e active a wodi adwumadi no nti me share na bound no e very high na free no e very very low and so na man patch nti e de na ye di money nyina na enye adwuma what we found out na say or is any pana or was a genetic predisposition and in the podiana converting a testosterone to estrogen or on the very no say aromatization until on say many the primary care casania money drobia a friend and nastrazo are a blockage testosterone say back estrogen sandro na kwana tell you so for more breast cancer and animal until that's how I approach it until with answering your question yes it was how
Yo doc yɛmfa yɛni ɛnkyerɛ ɛyɛ ɛkwan a yɛfa so a yɛsi handle anase yɛsi approach saa testosterone yɛfa no ɛyɛ traditional medicine mu a akɔyɛ sɛ mo no sa yɛ wo hyɛ kyɛ mienu yi sɛ yɛba no ɛyɛ functional medicine mu a approach ni sɛn na mo si esi yɛfa no
yo me da wase so conventional in so obi a team na sɛ wonu mu bi a wa approach in primary care anase neurologist say olotia na say yen hwehweme so olotia abribia no the treatment na ye back hormone replacement on the traditional approach oba ya so ye ha ye wo creams ye de ye ho ye wo panier ye de wo mo bi ha bi one weekly bi one once a month bi wo patch mo ye no weekly se nyema bebre ho a ye testosterone basically bi so ye patch bi so ye nkun yina no testosterone na yede ma ntono ne the conventional way no interestingly no the interesting is say ka hormones any sa hormone replacement ya ye badwen say emma momu na omodwene hormone replacement kitro modru menopause no munya symptoms of vaginal dryness ni ade no sadly na say interestingly no me hu emma bebre a omusiki more hormone replacement than emma kra
what can we do na ehun akohia say o say mebusa say DNT ana osusu say mema bebre no omode o mani e kire saa kwan we su say de be ya ombenya o mahoto ne omatima ko manim na ma de omo nya o madwen say omode o mani be kire saa kwan no so
yo me da wase am say it turns the media no any mainstream media no for that matter omo aka ho asem obo hu de wuro bebre say hormones no unya cancer ni ade intenam santi imman bebre no reluctant omo pese omo beko sa aroused no men no so on the other hand no omo they are experiencing hormone issue no and I hear popular conversation among a lot of men now as a matter of fact good amount of testosterone na unyiniche and most men no is that say low T na or na experience sa symptoms no ana na ye ka wasem ade ba kwa te hu men na mo low T no fatigue bibia no ma bro but man the 8 hours and so be tired mental clarity they bia no brain fog or issue with mentally in of course lack of libido ade ba kwa me hu power share ha in terms of low T I did pa lack of motivation. No matter what, you can't get them to be motivated. Only one of the things that are affecting memory when they have low T, and only one of the things that most conventional, young catching it means the misdiagnosis at the bottom. And of course, who low T, so you see erectile dysfunction. I've been making say impotence, and as even make say or dogbnadane, or however you may call it. And those are all things that affect low T. Into enam sanity, mema so no you pursue live vital lives. Into enam sanity, you pursue into most men will seek the treatment. Nipa mako and I just because of obi who already package insect na na say be a monograph na side effect na what sa testosterone no aya na dose tene ehunahuna bebre na emo mujai but nipa no bebre no men no bebre no and I say men no bebre no they will go for the hormone replacement because they want to live vital life said an American.
All right, abusian for 28 minutes after 7 p.m. live on Asumdwe Radio. No you didn't come out wapom Tesen so health talk you didn't come out said ya be ya pom din betimi asisu so dia mayen enoma hudo bebre na ekoso ya brabom na obi kura fa ne say normal we de obi say was we de normal bibia nim na numre doc am ye din komo ye din nyina no ye low testosterone say we were low testosterone ma ho nyafe obobia ne timi sesa dog person o chese so testosterone ni gina ne na so a and timi ma obema we gina se bema o gina brane ututu a ja etu ni timi se bi kuma aboa e de ba fie bema ututu ni timi kuma aboa mfa ne ba fie na kire se utuo no nya tuwa ntine so timi etu wana mo na doc guso ade nsam no tutudwa ede amayen doc ye have challenge ahudu wom se koba se mutu anamo person mu tu anamo fa ye testosterone ho a challenges be na ya na osusu se omo efesi
yo in traditional medicine and as a conventional medicine and as them talking as allopathic medicine the challenge in your diagnosis piece because they tend to say in order for so you be diagnosed you be say or low T I need a percent testosterone levels near about 200 250 across Arabia 300 into was our ranges here and you consider and say low T into or no any the biggest issue because in purpose our numbers we so no we say 200 250 ni 300 and nipan people no I know omonyi omo komoni mu mfiem na we say our numbers into nipan people no so we obi baba or ni mfie no ewo form na numbers no any sa range ya bia na numbers no make bia ewo buruwe no so a is not considered low T as a matter of fact no ye diagnose no na atoso akoso na the how bebre abre no those are the things that you in terms of the challenges the diagnosis factor no and the conventional medicine a problem
Oboni beka say why is this problem obeso the entina a problem
said and make a problem because I have 200 and 300 testosterone levels, it's a number you typically see in the average 97-year-old. Will be a 190s and I'll be 200, 200 and said the attendance because of that, so be a young not or not so blue hona, not all symptoms no crana yembuano, and that is the problem. And I believe said that is why Nipan Bibre and one of the things that driving me to talk about this. One of the patients in Yana Enran or Spanish is 6 to 8 months, 52-year-old. Now for also only diabetes, only BBR, but also someone or you want to cut grass into someone who iron and blood pressure no cost 6 to 8 months now, completely nil. BBR new off. Now you know blaming say bia or you do our wanting to be or excuse me or mpana wa wanting as BB, but the point of the matter is completely no, and I mean Kasa extensively as a high year, so he came as a matter of fact. I said when you Thursday. The problem is the numbers and so according to the numbers again and yet it's 200 and 300, but this guy is off. But the number from him standpoint in there is not good. He needs treatment. And this other penalty and he said, 200 and 300 for now. Say, honey, trans will be drawn and I diagnose with ya, and most people you be diagnosed with, but yes, no moon do some numbers see, and so no more show symptoms of low T. And when it comes to any approach, we don't treat the number, but you treat the patient.
And you know, money where the best says, Mukrumshas, yes, or to train banner now or to train who quit that. Nano interest any nano or for Baba for them, and come on, ye, the natural say, Papa. Normal Jacob Bonenti, a best as a munina, na yammoa, memano, na yentimi any yarisa, was aquine. So now, you can't the normal a year number for Bema, dog say a woman, if you bears a duno quadrasa, 20 years, between 20 years and 30 years. The normal range number Ben officer or Sanko Mujina.
Typically, Bema Bia, you are looking say, I saw bro 600. So anywhere from 600 to 1,000 is okay. Until over 600 is a good place to start.
So Bema, I won't fear bears 48. Alcohol, I could do bears 53. None a testosterone, no 400. Yana, and as a baby, Bonnie Biwum.
Yo, so do 48, and I say, and I said the kind 53, and I say, Obana and Bia. The T level only 400, but on feel good. Or I know a bread, the erections in your papa on your motivated. Typically, conventionally, Omega say your numbers are good because 300, only 200, one said or more person would run a diagnosis. But really, Obi so would the nippers are maintain the number near 400 are really they need help. They have low T. In the conventional, they train say we do 200, 250, 300. But this guy are working or 48 and also 53. The number is 400. But yet, we feel good. There be no bread or bet why that there be we are no bread. Ni erection, your papa, only motivation. definitely this guy needs help, and from a holistic standpoint, this is a person I will be treating.
So me bu so bi ma adwuma wa ye ba no your traditional approach eno nko an how abudu asusu say emema no omu FAC ana say bibi fufuro bi wo ho a ahinta ya wo se ye hu.
Yo, me da was say no, say yeah talking about Saudi we are mostly conventional and as traditional, you know. The any person say you replace testosterone, and that's not the approach. You go with in the root cause approach, and that's a functional approach, you know, because you tell say testosterone without really addressing the issue now. What it does, and it's a hormone into natural way of producing testosterone becomes disabled. So the abrubia make us say we are diabetic. Now, Dr. Nan check it will be a friend of say C peptide. Now, one has our pancreas in the year you may produce insulin, or start to warm our insulin. Or pancreas need insulin near. Into one insulin now cost for years, but I don't know pancreas in any will cry because they be an insulin warm into among how much pumping insulin. Same thing with the friend saying testosterone, which is also another hormone. Into also say challenge back when I say so right off the bat, no start to say who replace testosterone, then you are deactivating the natural ability to produce testosterone, and therefore it can be a problem long term.
Yeah, say you ba say you two as your correct free ho a wo a functional approach a kwan be na e be fa so.
Abribian you kind of I first dig into their lifestyle, very very important because there are so many people are say any idea or genetic predisposition and also what issue be typical anything. Most people you can just from levels of 400 you can change their levels from 400 to 600 with just lifestyle changes and addressing certain comorbidities, and that's just the sad reality. Until we changes or more abrabo and I say how munya pet idea 400 na basis and na all of a sudden no munya boost. And nipa bebre or ha or more about they are not really patient because when you're patient they are not seeing me as on one-on-one basis, but a more issue that you do come. This is what I want you to do. Your way. Yeah, within a month, then they are telling you different stories. Say, oh, wow, all of a sudden, you know, yes, until lifestyle issues, you know, it play a very, very big role, and I've seen it time and time again in this practice where just lifestyle change, you know, to me will be from 400 to 600 without taking a drobia.
Doc, we hear a normal me and son, and me person me busa na ye mu how I was a normal me and same say to me are 30 a low tier. Baku and say Bema or tell you more spam, they say be one day or ne home band pa yeah na say or she shaswa and it's our tane ma a play be say passo agro. Ne any bema or town so yeah juma or heat mu pa just any environment na one or heat mu pa any bema or bobete o mi ani yam pa no ma me saying e mu de hin na kutia e yellow testosterone.
Yo, I'm saying me fa na ma ko I'm saying okay. The kind of also on your hand.
And no ye bema or talusu spam say dia or pago passo agropa.
Okay, yo. The no cry woman say anytime I will lose sperm, you lose zinc. Zinc here, dia kotenepa I will a friend saying how ye sperm, you can spermatogenesis, you know. And he said, we anytime we you want to replenish Niamana will lose in zinc. It be a cotton so build it with testosterone. Niama Bakumuna met me right off the bat, it will be a bema be here a zinc, and we be a friend of boron, BORON. And he said, we are there, what I said now. You definitely want to replenish, and I say give the Niama, so we big boost to friends with T levels, because who T levels are who are on who libido, who desire, who the edge. You probably be bring any edge, and that's because of lack of sardian. Yes, until we are no benesano, abrubiano, you want to do things to replenish that into only. And I'm saying, you told me no say heat mo. Yeah, heat. Not dependent your coso. So who heat ma heat no it me as say who sperm. Now anytime we are putting the body under stress, it can affect your T levels. Because of stress, because of heat, your body on pay heat, into yes, and now you are producing BBA friend stress hormone cortisol. Now cortisol, interestingly, cortisol now you can watch cortisol is made from cholesterol. Cholesterol also need testosterone. Into say stressing the you are increasing cortisol, and cortisol stressing cortisol is made from cholesterol now so here the testosterone, and that can affect it into absolutely heat more bit mass and it miss was sperm cry into onone and then said the third question beside also be a belt or dimia. Yes, one of the things that testosterone is made in the testicles into cause of obstruction. You want to have that free movement of things. And definitely, keep in mind, say the baby can say, oh yeah, I did be out of the ordinary. Oh, stressing you produce stress. And anytime you produce stress, you affect a lot of hormones. And just with this blood can affect that because you be causing my friend saying comfort issues, and that will predispose yourself to high levels of cortisol, and that can affect it. The name means that we say idea bit affect T levels.
All right, abusia yeguswa kasima be said na ya dwumedia no be na biguswa ebusa doc questions now your live on Facebook. At the same time, live on Asumdue Radio, Instrument Radio, and Asetanapa Radio. Then you know Asumdue Media, yen affiliation no. Now, Doc, yen sound to a young quay. Now, manyan yes, marijuana, and I say Tampi, and I say Becano, a weedy idea, Sebema and no more. A man and hoarding Emanya, Unyobano Januswa, and Yasam Gatua. No cry, and I say in Trubium.
Yo, that's it. I did any pan be brave, Matis had any a pain. But no crow say in Tampa smoking, anything like that, as a matter of fact, will decrease your T levels. A lot of research say marijuana and also smoking will affect your T levels in T. Definitely, so we are smoking will smoke marijuana for a long time. They do intend so they have T level. Others that will cause them ED issue, and I say they don't have desire for into that's what it is. Marijuana, and it has strong impact on testosterone levels. Now,
you stress, and also will testosterone back.
Absolutely, stress said that not make an idea be a cotton. My friend saying testosterone. In fact, the study be now football game. Into before a football game, you measure will be at T levels before the football game, and you measure after the football game. No more Lucy, or more Lucy game, supporters no Lucy game, after the game, no more T levels form or no trail say mental state affect hormones. As a matter of fact, or more no T levels were formed, titru or more must anchor gambling can or more T levels were further dampened into a clear sign say stress diacotino woman as a mental state diacotino when it comes to my friend saying with testosterone into so stress will feel from a human from sikasem it affects animal into who has the issue now or titro nippon be more Ghana no it has to do with be a financial issue akofa or more ED issue in animal be a service sikasem and I say how be a air cost one abroad yes stress diacotino power testosterone
now in the DNS to say and I see to me my testosterone call form
Edi akotene power. Eduane dey fundamental or any the building block for everything I hear. A hormones here testosterone here certain macronutrients ewonduan. For example, here healthy fat to healthy fat say they build the cholesterol. Here cholesterol and you dey testosterone. So the na make an earlier no. Into say cholesterol with testosterone. Into say diet a deficient of a what is a healthy fat say your salmon, your fatty fish, and your tuna, your mackerel na it may affect your hormones. Definitely Sanya money na ya the akotene power into your suggestions will be a treating for T levels and you never be go in terms of helping build the testosterone.
na yɛn hwɛ ɔmo so no ma start efa tea a medication no so sign it here.
Yo, when it comes to akasefo obi a oso bia no wo belly fat bia no it's just a lot of estrogen. Now estrogen so that means it's going to affect your testosterone because you don't want too much estrogen. Estrogen is a hormone. Inti se ubo home bema bia sebi nifuno a dose be bria it says high levels of insulin and high levels of estrogen and estrogen also no a dose one or a more feminine features any intona nipan be breno or more yeromo ho or mon plan for ho but man she be a wo we asibia but upon no desire no edge no lack of libido and as a lack of libido energy tini na ya dia e dia kotene wo
yate time bia ye cancer or say cortisol still na e ba no cortisol still and you say anything ana eno Kwame na fast will affect T levels.
Yo, you say you can say cortisol still and say cortisol is area there. So then na make cortisol, a stress hormone, is made from cholesterol. Okay, testosterone is also made from cholesterol. It is a poor diet, lack of processed foods, lack of healthy fat, and a imbalance. You produce too much cortisol. And cortisol, so we produce too much cortisol. And then say cortisol is the cholesterol. That means cholesterol is taking over, is having a better part of the cholesterol from, say, you debate testosterone. You hear cholesterol, the testosterone. You have cholesterol, so the cortisol. Until we produce too much cortisol, it's just a cortisol. No, you use all the cholesterol available. No, until primarily, no, you use your cholesterol. No, for just producing cortisol. Only your friends say cortisol still. No, until or no, your idea impacted your testosterone, but until cortisol still. No, idea hard in the baby. Until your friends say was sink. Cholesterol cholesterol corona wo testosterone cholesterol corona wo stress hormone cortisol so we too much stress wo imbalance na so we make it too much cortisol it means say you are taken away from the testosterone no the cortisol which further decreases your testosterone or not cover how be brain take cortisol still hard in the when it comes to T levels.
Dog yanhwe ni nyina no man pii no se enuanedie ade di mu akotene ye kan nutrition na ye kan nutrition ade na wose ye
yo ye kan nutrition said na make an healthy fat ye hia cholesterol into saturated fat ye ade ye hia pa in terms of your cholesterol into fatty fish, salmon, tuna, mackerel, sardine ni na ye fatty fish my good cholesterol you here to build testosterone and of course a bit more also good old fish oil to be also building testosterone you have to be on a quality fish oil because only need the building blocks on any idea you see down which is making of the testosterone and it's an idea in here and of course besides that you want to stay away from processed foods near starch and also too much insulin pay too much insulin into na me can't be say true green food because starch form insulin cholesterol bebre kakre bi so we did now so sugar na 100 at least 1 hour later and I say postprandial no we check now you 140 or less and spike insulin bebre into how brain pediano and to my nipa bibru ha me no my I can't from by way of talking to them here one on one say one of the things I went to my and say be an over try say only the 3 hours before and so I couldn't say well last meal is 6 at least by 9 ubi to me at that in the most times we did 5 by 8 ubi to me at that and everyone say we did 5 about 9 as a common don't get but when you did at that point was sexual performance would be excellent. But one yes, I say beer, who did 5 no, who could do fear now about 9, 10 when you come. But what could take a more di, what could take your love for BD. That's all have an actor you see say or performance is impacted into high insulin levels are affected your T levels nti nipa bia no ese ye hu say you be stay away from niema ema ye starch no ekosoro. You want to stay away from all these foods because high insulin no will cause that problem. One of the things that me hu abribia ne say nipa no bebre no entumi enhu ade a starch wo ni ade a starch nim. Nipa no bebre kwa di omoni na ehwe say ade we me twi na starch wo, especially through green food. When people was oh yes not the starch and yes the starchiness and I said the thickness and I said the gooiness no the manifest starch the concentration of in a woman on the money it's not really about that into you see who nipa be brain maybe answer na because only and never say or send by a doctor only say body and no starch on the only say be other thing into you see who in your starch and again Muslims to starch but in the door on only a key until as you establish that no about me who never be brave into the bema be a 3 hours before any bema be a crab but will be but remember no specifically because of T levels you want to have your last meal 3 hours and sana wakoda 3 hours before and sana wakoda to better 9 would this 6 you okay. You don't want to have high T levels. Nebu okrana so we are severely insulin resistant. Not so could be a more fiber. About 10, 11 okwana insulin no. So insulin and back from intended terms are so you do a month and you must do rice and a maybe you can get away with that. But so could you rice by 3, 4 no so it's severely insulin resistant. You mean no okoda na we insulin also and that will have impact on your T levels.
Doc, I say any pan of fruit, I shall say, I can see, and I bear my fruit, shall say, I can say, and I test from no, I affecting an
absolutely. So, will be away from Cassibiantes or high levels of insulin because insulin causes our fat deposition in the belly area, and most guys now more big belly, high levels of insulin and low levels of T, and they start getting what we call man boobs and almost any panel both the first or a very hairy power both was started say ulusu hair no on their body. Nina is sign say my friend is saying or high low T and Nina is because of high insulin, high estrogen and low T.
Testosterone hon koma yedi ebetimi a convert aye estrogen ana
testosterone e convert ko ye estrogen da idea cotton diet play a big role into diet your diet so into basically if you want good sexual function you want to pay attention to your diet and the belly fat has to go so belly fat no conform sexual function and vice versa into so per the obetumi aya ma yefunu no conform and it will help you a lot into yes and idea ba ko nipa no bebrezu nim ne say alcohol insa converted testosterone into estrogen into biana OT level no low no so you want to start paying attention to alcohol because alcohol converted testosterone into estrogen. Basically alcohol ma what dane bema a fall from bema to oba because estrogen na yemba hormone testosterone na yemba hormone into alcohol no that if you no alcohol na pe na chemical and are converted into estrogen. Obi or no mensan equation be what with time no what will gain weight na been no football and in year from year kase na mukase belly Ghana say you sick flu in science or too much insulin, too much estrogen, and that will cause our issue. Until person umpema grow improve you have to decrease your belly fat.
Now you on record ebetima ba se obi ho a oni sa fat belly and as belly fatty ono susu ane no fo ensha sese bobo na susu na ne T level formana.
Yes. I can't want some that was for no dangerous or almost any pass course and omunya sugar issue are dangerous. Omunya skin, omo flat stomach, bibia, they have low teeth, they have high sugar, severely insulin resistance. Into any paconos or how you approach they may not have belly fat, but they have high levels of insulin. People be brewa, A1C is looking good, but check fasting insulin, then I'm 11, then I'm 12. It depends. That's why in function we try to test to make sure what is happening. Ultimately, find just say, oh, we see me see there or skinny. As a matter of fact, me who more skinny people, more dangerous chain, Acasafona, or Mobahano. Until you know it depended and anything I test say, ye ain't film, and so see me see the would any strong call, and anything I bring make us say, one name Amma Baba, and that's only Coffee Baba, one no sister Baba, and that's no twin brother Baba, and that's all twin sister Baba. We now more diabetes, dear, but moving in real different, and that's our approaching very different because we be a dear no, or dear a chassis, and that's a dear coffee, dear no, a dear by a bit dear heavy metals, a bit dear. Maybe plastics. It depending on cost.
Doc, you can't hormones. Once a month. Now you bet make I said thyroid functions. You bet me akotena hormones more na.
Absolutely. Will be our thyroid issue be no our issue with testosterone. Through hypothyroidism. Into nipa be brain now more hypothyroidism no. Almost low sexual desire. Say mouse and memo. It affected them.
Nadia, we may can say, when you say your normal baby can say a year T level CDR. Na answer no, young Kwan Homanoso, na Minya Mr. Bismarck, our Homanoso, na Yana Jointre, na Yubiana, Yadia Canava be goofy, I see. Mr. Bismarck, I'm Quaba. Mr. Bismarck. Mr. Bismarck, what's the main? Okay. All right, Doc. With you, my advice. You will any test I was here taking. Now you bet me on who your testosterone level. Any medication be I say it me chance say fa. So be man testosterone start to say you good ra. The no for na ahye ni na ni. The you for ni dey say ma from.
Yo me da wase. I'm say it's you for Rebecca ya. Everybia na ye can wait asem and I say you can you know. One parameter they be ameka say enye thyroid na ehyasia ade ba ko ye see ehwe insulin levels. Insulin level no say drop without say insulin be drop no din say be lose weight unless oba ko ye surgery. But ye surgery ko na say habit na do ko on once sana you get the weight back. It's very, very important. It is a start to say will drop and of course it has taken you years to cause this damage into any 2 days, any 3, it may be 3 months, it may be 6, it may be a year, sometimes even more. But the thing is that the key thing is that you be focused on dropping insulin, big thing. And then say my cancer probably breathe say so doctor your tester. So you're diabetic, so you're diabetic, who faster insulin. Yes, so we drop over insulin. That's the first thing. So we start to drop over insulin, the belly fat will start going away because on insulin and a storage hormone, a year the bridge fat storage back. Into so only what then you get into a protocol and find catabolism, meaning breaking down because you don't have insulin not to store, which is anabolism, and that's anabolic, no. Into you definitely want to decrease insulin. How do you decrease insulin? By starting to watch your diet. The problem there, nipple brain, not through ye room for you to lose, say, you need the yen, to how per se will lose a friend saying, yeah, ne belly, no. But make us say, anapano, would be only 3 mono, a very healthy. Ebini saying, to me the body when the body obey the body in area and upon obey the oatmeal. This Nema Mienu Kakewe increase insulin into by 100 years. You need to do things about more insulin number from we got into the enemy. Typical example would be eggs, steak, and be a non-starchy vegetables. Between the BB friends say cruciferous vegetables, it been a bok choy, it been a broccoli, it been a cauliflower. Because the American cruciferous vegetables, what it does, it decreases estrogen into upon one. A boy say, Emma comment don't tell mom good into 2. I did back on so to my incorporated said that would be American intermittent fasting, long without eating, drop insulin. That's the fastest way any fasting, so we drop insulin. What me drop insulin, fat loss will be expedited into. Man boobs in Nabeco because they are there because of insulin. We drop insulin now, it will also go. Insulin dropping a day. I only need the problem because you knew because typically so only kind of for 10 because 9 because say it's the party in the take nippon be bria service Oma tie no after the Oma come to accept to say, oh okay, I deal with them in my message and say nippon be brave. Say last week nipa no be wo do send the labs na just for viewing purposes. I na and they just by listening to Asumdwe Radio nipa bebre a change on my life. I among direct patients, but they just listen to good counsel. And they're very important. It's say insulin never form there, you will see that change. Insulin is part in your problem because of your new and na market, your board, your man can your jollof rice, even your salad no crano, and you can't say Ghana salad no crano is not enough to help because salad dressing no starting big beans and said they are Americano. So you have to stay away from legumes, lentils, and this animal. And you say, when you young guy do through animal, then you stay there. And the insulin is a big factor. Also, insulin, what's the weight loss anymore?
All right, Doc. I read your baby. Do you mean take home message now? You're for Jumedi in here.
Yo, me do I say. Said it, near canon. T levels and men, a lot of complexities in there. Be idea no, dear, a cofaba. You will be a friend of sex hormone binding globulin. A idea, so high levels of insulin increase to high levels of estrogen. Estrogen so increases again, sex hormone binding globulin. Now, that the INS say, with T levels and you're free in a bound. There was high levels of sex hormone binding globulin. Touch you free now, on more power, more the age, one they are active, now how they are bro. And they are very important. Say you who say, you better address the audience. Okay, how do we stop that? Into so would you your congenital issue? I say you intervene. Of course, there are so many ways, but Nippon Bibroha, Anas me pentama, many or more Euro Casa, near more Mobibia, a mild road. This usually the mom bomb breast cancer to stop that. May know 1 or 2 times in this practice, but it works beautifully. Into Nino. The Mika question say a very complex issue. Ubia diano ewo said na ubisa say ubuha or flat tummy any bibia and so or low T or no so tini na dependent as how the obesa no na be no high T high insulin and also or high levels of other issues and also bu hokana or congenital issue no issue when you bring e never be brave. You have to see the big picture. Your test be a friend Dutch test. That test no only function on quantity test no no every step of the way a show hormone way the converted koye na the entire way say no na me to me who say hormone no obi oba ha na your man patch no your man testosterone patch there and so e could really pedwin ma e kodane emba hormone make us say your friend say aromatization tini na no it depended into say abrubian dem can say so who exhaust all options are. Then you can look at hormone replacement therapy, but only the last resort because anytime I call that route, we deactivate, we need to and that's our natural ability to do that. And to be the man who that I be maybe no, I didn't know how or help the same. Obia catcher and I said, Dr. Bia catcher say, situation hope will be anyhow. And as I say, your catcher say, with the I just say, with the co womb, Obu high, I say. What trying doing but in Druna Buano, in Tenyadia, and Dasobia or Sani Pantano, Namikajo say, we need a green health pharmacy, any functional medicine center, because we are not your regular pharmacy, any functional medicine center, meaning say Yariano, you get it to the root of the issue. You train you run a test just to get to the bottom of the issue. Inti, so what's our problem? No, you can't be actual. That's a one TRC, and I say it doing for years. One Brofun for years. I may be your guy. Medino, the Dr. Kwame Ennin, the donor from Dr. E. Nasane Makramo. All
right, Dr. Kwame Ennin, and Mayor Devasi, sir, and also Oba. Mr. Obeso of Frey, a green hair pharmacy, and I said Dr. Kwame Ennin, number between me after one, I was so a 703 670 3640 703 670 3640 betimi afro omna emwa bia wo hia bia no say wo call how be me to say mu a e ade ehia be ma wutu ntimi ntu bi mu a na che say abaji utu sa kwan so na ya hadwene te so me ya betimi led wa kwasate etate bia num Mr. Bomodin so be friend green hair pharmacy Dr. Kwame Ennin na nyame fa no so entimi emo eni no ma hodo de agu akwan so betimi adi so se de be ya betimi abo Mr. Mami mohwi na menko African International Market Mr. say open ani ahodo ato na say ope ahoho aba ofi sa ahoho kra ma ofi open ani bebre ato de abegu fi se de be ya ho nkire wa eni Bomodin afo ani kire African International Market omodin na almost say home of quality and African and Caribbean foods are ukohonoma no ahudu bebre nuane ben na ope nambe na ope wole ope smoke fish ana ope cow feet just a bibia ohia bia ubetimi enya bi ohonoma so no more cosmetics ahudu enkube na apedi asra body ama eso enyomenome edi ama wo bomodin afo ni chom betimi abo ama bibia atimi akokama omo 289 Muddy Branch Road, Gettysburg, Maryland 20878 mobile Planet Fitness and Lots obomodi about me abo mesrew se bibi ni na bia wa yira okwan bi so na se ohia question bi ana adwenchire bia bomodi na frɛ wo mo 2404774831 2404774831 asa 301-237-5497 wono betimi ajo so na bi ohia bia no betimi aye di amawo Ebeda busuafo amoba betie nyina mo live for YouTube nyina so ebeda mase na mo amutie live for Asumdwe Radio Instrument Radio Asetena Pa Radio so eguso anso damo ase na sa media mesre mo Saturday be repeat anapata ni mra metie dwumadi adu so no Asetena mu nsam ya chance for almost 3 weeks ni mesre we ade a meka 3 weeks and say week bia no ye obaso mie no 2 times Tuesday and Friday nti third episode eba so story a one chance ya wode eba mesra wo hia so betie story ati sei o kan tete no ye nana mo chi etena konkonu ya se kan story che na yi wunya ba bia no atie Asumdwe Radio edwena atie fo nti wono akwakofa aba se ebusuafo mna betie Tuesday enumre 7 anase 8 ya ye sorry so pe na mam pokua PhD no de dwumadie no Asetena mu nsam ode ebrewo ye wiepe na Friday so anumre 9 pm so yesado into aso so ade abrewo ntimi srawo oboni be say you can't afford to miss this show bomodin say ubeti bedama say na ye de to aso no bebrewo nyame adoma next week Tuesday ebeba niasade wapom tesa bro ti monkoso amoma fidi na Rare Princess of the Airwaves Monday through Friday brabeti no anapa 9 am ekuzi 11 am bebo onyakopon na me so be nsanche ni bebre